Thank you for joining us for today's seminar. Happy to introduce Dr. Susan Mason. She's Associate Professor in the Division of Epidemiology and Community Health, received her PhD in Epi from UNC Chapel Hill. She's a member of our Healthy Weight Research Center. Dr. Mason is a social epidemiologist with a research focus on the population health impacts of adverse and traumatic experiences, including childhood abuse and neglect, sexual violence, racial segregation, and other forms of violence and social marginalization. The overarching goal of her work is to advance the evidence base for clinical practice and public health action to prevent these prevalent adverse exposures and outcomes. She's been very well funded by NIH and other sources as COI and PI. And so today we're going to hear about her latest innovative work using Google Health Trends to conduct child maltreatment surveillance during the COVID-19 pandemic. Susan?
Awesome. Thank you, Mark. Hello, everyone. I wish I was seeing you in person in WBOB. How we all miss it. I'm going to share my screen here. So I'm really excited to share this project with you, which is a project where I've probably learned more than almost in any other project I've done. I will start, however, with a caveat that this is going to be a bit of a wonky methods talk. So if you're here to get the truth for sure answer to the question of what's happening with child maltreatment during COVID-19, I'm afraid you've come to the wrong talk. So now is the time to sign off. But if you're interested in these methods, then stick around and I will talk through what we've done. I want to start with acknowledgements. I have two great co-investigators, Corinne Riddell and Jennifer Ahern at University of California at Berkeley. And then three absolutely wonderful grad students who've been basically the machine behind this. The two Kristas at UC Berkeley, and then my student Jeannie Santallaria here at University of Minnesota. And our funding came from the FBCH Holly COVID-19 Award, which got us started, and then Corinne secured an additional set of funds from the Berkeley Population Center to continue the work that we're doing. Okay, so in this talk, I'm going to spend a fair bit of time in background because I think that it's important to establish why we chose to use Google Health Trends data in the first place. I'm going to spend some time talking about Google Health Trends data because it's something we had to learn a lot about, and I'm hoping that it will be of interest to people to learn what we've learned. I'll go through the analytic approach and then results, and then talk a little bit about implications and next steps. Okay, so child maltreatment, and when I say child maltreatment, I mean abuse and neglect. It's the sort of umbrella term for that. This is a massive public health problem that I think is underappreciated. First of all, it's highly prevalent, a lot more prevalent than people typically, I think, appreciate. 1 in 3 US adults report a history of abuse or neglect, and analyses of child protection data actually suggest 1 in 3 children will be part of a maltreatment investigation by the time they turn 18. Maltreatment in childhood is linked to numerous leading causes of death later in life. It's associated with adult substance use disorder, obesity, cardiometabolic disease. And there are a number of plausible mechanisms that are being articulated through a number of animal models and other approaches. And these kind of fall into two camps, one through a behavioral pathway that starts with emotional dysregulation and maladaptive coping, and another through neurophysiological impacts of toxic stress. These aren't mutually exclusive. They both may be operating. I don't think it'll come as a surprise to anyone to know that COVID-19 and the mitigation policies have resulted in pretty major disruptions to everyone, and families have felt this particularly hard. So we've experienced school and childcare closures, mass unemployment, precarious housing, disruptions to services for high-risk children. So children who need special services are not currently, in many cases, getting those services. There's isolation from normal social supports like extended family. And then, of course, many of us are experiencing additional stress and mental health challenges. And all of these things are risk factors for maltreatment. This list here, the risk factors and protective factors, come from the CDC, and I bolded the risk factors and protective factors that may be exacerbated or initiated by the COVID-19 pandemic. So on the risk factor side, we have substance abuse and mental health issues in the family, social isolation, family stress. On the protective factors side, we've had disruptions to social networks, to parental employment, to adequate housing, to access to care, healthcare and services, and to access to adults outside the family. So our question was, what is the impact of COVID-19 mitigation policies? And we were particularly interested in shelter-in-place orders on child maltreatment risk. So I want to pause here and go put my Epi1 hat on and just zoom out and say, well, how do we know what is happening with the health and well-being during the COVID-19 pandemic, or really at any other time for that matter? And I realize I'm preaching to the choir here when I point out that this is through public health surveillance, which the World Health Organization defines as continuous systematic collection, analysis, and interpretation of health-related data needed for the planning, implementation, and evaluation of public health practice. And I would just add to this that we want continuous, systematic, as well as valid and reliable data to do surveillance. So what do we have for child maltreatment surveillance? Well, there are three main data sources that are used for child maltreatment surveillance, and I'm gonna spend a little bit of time just talking through them. The first one, and really the main one, is the National Child Abuse and Neglect Data System, or NCANS, and I'll probably refer to it as NCANS because it's a mouthful. And that's the one that really typically gets used in research and surveillance, and for any pronouncement about what's happening with maltreatment typically comes from NCANS. There's also the National Incidence Studies and the National Survey of Crimes Against Children, and I'll talk about this very briefly, but spoiler alert, none of these really meet the need that we have right now. The National Child Abuse and Neglect Data System is a compilation of state and local child protection systems data on child abuse and neglect reports, investigations, and substantiation. So this gets compiled at the national level. I think, I don't know what exactly the temporal granularity is, but it is continuous and systematic. So that sounds great in theory, but I just wanted to walk you through some data and let you know why I am skeptical of these data. This map shows the victimization rate per 1,000 in 2018 based on NCANS data. So victimization means the number of, so it's basically the number of kids who were confirmed to experience abuse and neglect per 1,000. And I just want to ask a few questions about these data. Do we really think that Massachusetts has twice the rate of maltreatment as Louisiana? So Massachusetts in 2018 had a rate of 19 per 1,000, and Louisiana had a rate of 9 per 1,000. Do we think South Carolina had 5 times the maltreatment rate of North Carolina, their neighbors? South Carolina's maltreatment rate was 17 per 1,000, and North Carolina's was 3 per 1,000 in 2018, according to NCANS. And then I want to just focus here on Minnesota in 2014 and 2018. So in 2014, Minnesota had a rate of 3 per 1,000, according to NCANS, a victimization rate. And in 2018, it doubled to 6 per 1,000. And if that's true, if the maltreatment rate doubled in 4 years in Minnesota, then I think we should all be quite worried about an epidemic. However, I want to offer an alternative explanation, which is that at the end of 2014, there was a very high profile death of a child by his mother. And it turned out that there were numerous reports to child protection about this child that caregivers, child care providers were suspecting abuse, and nothing was done. So when this came out, the governor actually convened an expert panel and they made a bunch of recommendations. And here's a little bit of news coverage. And you can see that it says here that starting immediately, the Department of Human Services will begin monthly random reviews of county screening decisions. And these choices determine whether or not allegations of child abuse are investigated. And then I also just want to point out this other little tidbit here, which is that only 29% of reports of suspected child abuse are investigated in Minnesota compared to a national average of 62%. And I'm not going to go into whether I think that's good or bad, but it is to note that there's massive state-to-state variation, and that big events like this high-profile child death can substantially change the behavior of people who work in this system. I don't want to go into detail about how child protection works. That's not the point of this talk. But I just wanted to show you the flow chart here. This is someone suspects maltreatment, calls child protection. This is a referral, and they go in, and this is where they get screened. So that's where they started basically reviewing all these screening decisions. But this isn't the only intersection where cases can kind of go one way or another, and the proportion of cases that go one way or another can affect the numbers that we see in NCAN's data. In particular, there's something called alternative response here, and different states over different time periods decide whether they want to track cases down what's called investigation, which can result in actually confirming a case of abuse, or alternative response, which actually cannot result in confirmation or basically a substantiation of that victimization. And so over time, those who gets transitioned into those different streams varies. The point here is just that there's a lot of system idiosyncrasies in these data. States differ in their definitions of child abuse and neglect. There's differences in how each case is quote unquote triaged into investigation or not. Child protection budgets are actually often tied to property taxes. So in Minnesota, for example, we have very high poverty counties that have very few child protection workers. But where I really want to focus this talk is on the last two bullets. So most reports or referrals into child protection are made by mandated reporters, and the bulk of those, the largest share of those, is educators. So clearly, when schools are closed, those interactions with mandated reporters are going to be diminished for children. And then secondly, here, investigations typically involve in-home visits, and many of these are stopped when COVID-19 hit. So the system itself is highly influenced by the pandemic and the attempts to prevent transmission. And for that reason, we just were not at all convinced that it was going to actually be able to detect. We thought it was highly limited in its capacity to detect child maltreatment during this time. The National Incidence Study was launched because there was an acknowledgement of the limits of these NCAN's data, but it's a bit strange. It combines NCAN's data with, quote, data on children who were not reported to CPS or who were screened out without investigation, who were recognized as maltreated by community professionals. No idea who those community professionals were, who suspected maltreatment but didn't report it. And unfortunately, there were only 4 waves, and the last one was 15 years ago, so this isn't useful to us. There's also a really interesting data source called the National Survey of Children's Exposure to Violence. This is run out of the University of New Hampshire. It's a quote unquote representative sample of 4,000 families. I say representative in quotes because they use random digit dialing, and I don't actually know who ends up in a sample where you use random digit dialing right now. So it's families with children. They collect both child and caregiver reports of child victimization, and this includes maltreatment. And they have 3 waves of data collection between 1997 and 2014. So clearly this is doesn't check the continuous box. And I think probably many of you will share my concerns about the validity of data on maltreatment coming from caregivers and or children in the presence of caregivers. So basically, existing child maltreatment surveillance data are really not adequate, I don't think, for understanding how maltreatment risk is affected by COVID-19. What we need are data that are nationally available, independent of interaction with mandated reporters, and not subject to sort of idiosyncratic variation in state or local level bureaucracies and budgets. So that's where Google Health Trends data come in, because in fact, they check these boxes. Let me just return to the research question so we can reframe how we approached this. So our question again was, what is the impact of COVID-19 mitigation policies? And in particular, we wanted to look at shelter-in-place orders on child maltreatment risk. And the overall analytic approach that we took was we wanted to apply a differences approach to compare the changes in maltreatment search volume from pre to post shelter in place, and I'm going to refer to this as SIP, among SIP states, those states that actually imposed SIP. And we compared that to changes in maltreatment over the same time period among states that did not impose SIP over that time. The exposure was shelter in place, and particularly the timing of the shelter in place. And we got those data from Boston University that compiled information on states that imposed shelter in place and when they did that. And we used additional information from the New York Times because there were some funny aspects of the BU data. But both BU and the New York Times assembled dates based on state-issued health mandates, executive orders, and local news reports. So basically, they did the work of scouring the interwebs for this information and pulled it all together. So that was fairly simple. Less simple was our outcome data. So for this, we used Google Health Trends, the Google Health Trends API. So in case you're not familiar with this, and I think many of us, I was not at all familiar with this when I started, I want to just tell you what this is. So Google provides data to the public via a quote application programming interface, or API. And they maintain a sample of all Google searches that can be queried by researchers using the API. When a query is performed, a second random sample, and actually the random is like a little bit of a question mark, it's not entirely clear what the sampling strategy is created for the requested geography and time frame. So if I ask for Minnesota in the whole year of 2018, then they will pull a random sample that is for that particular time frame. And from this second sample, the API returns a scaled number equal to the number of searches for the specified search terms as a proportion of total searches multiplied by a constant that I think is unknown to us, although the number, I think 10 million got floated out. It's a very opaque situation. And I bolded here this as a proportion of total searches because it was a little bit of the bane of our existence throughout this project. And I'm going to talk, and I'll sort of return to this issue a couple of times. So our crack team of amazing graduate students did an absolutely stellar job of really going through the qualitative literature and looking at validated child abuse scales to pull together terms that might be searched by a child experiencing physical abuse, sexual abuse, emotional abuse, or neglect. And then they went through and they did incognito searches using these terms to verify that they returned the expected websites. So with sexual abuse, we had to be a little bit careful about porn, for example. And then there was another example where it was a term, it was around neglect, and I think the term was something like mom's not home or something. We were trying to get at sort of kids being left behind. And there was this, it was totally swamped by some YouTube video that was like a song about what to do when mom's not home. So these incognito searches allowed us to sort of home in on a more specific set of terms that weren't pulling in a lot of chaff. So our general strategy was to basically combine a perpetrator with an action with me. So so for example, mom hit me would be one of the search terms. And then for each of those actions, we concatenated different perpetrators. We had multiple different actions for each of the domains of abuse and neglect. And then all of those were searched together. And we had a huge number of search terms that ended up in this query. So we ended up including search terms related to physical, sexual, and emotional abuse, and we ended up removing neglect because we just couldn't find search terms that we thought were specific enough. They kept sort of leading to these YouTube videos about like how to party when mom's not home. And we queried all these search terms combined for each state week from January 1st, 2018 through August 22nd. of 2020. Queries that yielded searches below a specific threshold are suppressed by the API. I guess there's some concern about, I'm just looking at the time, sorry, a concern about keeping things anonymous. And this is, of course, a particular problem for small states. However, we discovered that the API pulls a different random sample every 24 hours. So that means that every 24 hours, there's a somewhat different chance of a non-missing return on a query. So what we did to basically shore up our data against this missing data problem is we created 10 different samples, so one per day, and averaged the non-missing values. So you can imagine, think about the number of search terms every state week for the multiple years, and then doing that 10 times. So our graduate students just really, they earned their keep on this one. So I just want to pause here on this data suppression issue, because this is another thing that we really struggled with. So these are sort of the best analogies I could come up with. So the idea here is that Maine, a very small state, really ends up having much of their distribution below the line of suppression. If you imagine the water is the line that the API draws and says you can't have any information on anything below this line, then all we can see is the proverbial tip of the iceberg for Maine. In California, on the other hand, there's no line of suppression. It's so enormous that there was no need for the API to suppress anything. So the entire distribution is visible. And just to give you a visual of how the sampling worked, is if this is what Maine's iceberg looks like, you can imagine kind of sampling randomly in here. And in some cases, you hit water and that returns a missing. And in other cases, you actually hit a piece of the iceberg that's jutting out above, and that actually returns a non-missing value. But the thing that's going to happen, and did happen, is that what you get with those 10 random samples is that when you average them all together, you're really getting a skewed picture of the distribution, right? You're only getting an average of what's visible. You're not getting any picture here. Now, the good news was that, with a few assumptions, our difference in difference approach should essentially difference that out. As long as that suppression line isn't changing, those differences in the fact that we're just getting above the water view of the small states should be basically absorbed by our approach. Even with our multiple samples, we ultimately excluded 8 states and DC because they had almost no data on the outcome even after the sampling strategy. So they're all small: Alaska, Delaware, Montana, small population-wise, not not land mass-wise. Alaska, Delaware, Montana, North Dakota, Rhode Island, South Dakota, Vermont, and Wyoming. Okay, so remember that the API returns a scale number equal to the number of searches for the specified search terms as a proportion of total searches multiplied by a constant. And the fact that our search terms are a proportion of total searches is really kind of a non-issue as long as the proportion of total searches is not changing dramatically. However, there is quite a bit of evidence that pretty much everything changed during the pandemic. So that's one challenge that we faced. But there was a lot of signals suggesting that that the total searches were probably not staying constant, that they may be increasing dramatically. Now, this is from the New York Times. These are websites. This isn't Google searches. But if you just look at how the increase in average daily traffic of Facebook or Netflix or YouTube, they're going up so quickly. And there was other evidence as well to suggest that that just internet use is going up. And it kind of makes sense. People were stuck at home. And this was not even talking about Zoom, not talking about sort of webinar type uses. So anyway, so we were quite concerned about what this means, because even if child maltreatment searches are going up over this time, if total searches are going up faster, then it's going to look like child maltreatment searches are going down. And so we spent a bit of time trying to figure out how do we account for this. So one thing we did was we actually shifted to a multiplicative model from an additive model. So difference and difference models are typically performed on the absolute scale, but we did some preliminary analyses, what my colleague Corinne called toy examples, which I guess is a thing that statisticians talk about a lot, but I just love the idea of a toy example. They suggested that the relative measures could actually absorb some of the changes in total search volume. Essentially, they would be kind of canceled out by being in the numerator and the denominator. And then, so we sort of started to think about this multiplicative model. And then we also just were like, not that attached to the additive model, because there's nothing absolute about total search volume. It's a proportion of the total search volume. It doesn't have meaning in any kind of absolute way anyway. So we ended up, these are some of our toy examples, and we basically ran, these very, very simplified examples for ourselves to try to understand what happens if we use a difference model versus a ratio model. And so basically what we did is we said, well, what we really want to know is, are the total number of searches for abuse terms going up in SIP states and maybe staying constant in non-SIP states? This is state 1 imposes SIP in the second week, state 2 does not. So we want to know, what we really like to know is this difference, the difference between post-SIP and pre-SIP for this state 1 minus the same difference in state 2. So that's the truth here. But what we end up getting is this abuse volume, which is this number divided by this sum number of total searches. So we ran a bunch of different examples where we kind of manipulate the total searches so we could still understand, like, what is the truth that we want to get at, and does this the actual model with abuse volume, it's not the actual model, but the simplified version of the model with abuse volume, get us anywhere close? And so here what we found is that if the even if the pandemic affects total search volume, i.e., even if search volume is going up in both the states, SIP states and non-SIP states, so here it goes from 1,000 to 1,200 in both cases, the estimate here starts to get off from the truth, but on the multiplicative scale, we can recover the truth because that total searches get essentially canceled out by being in both the numerator and the denominator. However, if we have, if in fact it's SIP that affects the total search, i.e. SIP states have an increase in the total searches that go from 1,000 to 1,200, and non-SIP states do not. So in other words, if that increase is just in the SIP states, just caused by SIP itself, then our ratio measure also fails. So our analysis we ended up with Poisson models at regressing abuse search volume, by which I mean total searches, abuse searches divided by total searches, on indicators for time since SIP, where 0 represents no SIP in a given state week, and time since shelter in place is coded as indicators for each week of 1 to 10. Let me just check the chat. Oh, okay. Just want to make sure I hadn't gone silent on you or anything. We also included 51 indicators for calendar week to capture any seasonal issues, and as well as 2 indicators for calendar year to capture longer term changes. And we ran estimates that were conditional on state. This is equivalent to, but slightly more efficient than including indicators for state in the actual regression model. So instead of including, Maine, California, et cetera, indicators in the model, we just made it conditional on state. Okay. All right, so the exponentiated coefficient for a given SIP week is the estimated change in child abuse search volume in SIP states relative to the change in the non-SIP states over the same week. So we really struggled with what to call this. It's not an epi measure in any real way. I thought, well, maybe we should call this the ratio of ratios rather than the difference in differences, but I don't know. We've been struggling as we've been writing this paper up. It essentially is the ratio in the SIP states divided by, it's the post to pre ratio in the SIP states divided by the post to pre ratio in the non-SIP states. The assumptions of these models are that the trends were parallel prior to the SIP and the non-SIP states were parallel prior to the imposition of SIP, and that nothing else happened at the same time as the policy change that affected the outcome, and that there's no unmeasured time varying confounders, i.e. factors that varied within states over time that affected both the child base and also affected which states introduced the policy. One of these we can look at, this is parallel trends. So you can see that these are the SIP states and these are the control states, and they look pretty parallel. Although what I noticed is that I have a much easier time noting parallel, seeing whether things are parallel in difference than in ratio. So we ended up plotting the risk ratio and the risk difference. And you can see that the ratio actually ticks up a little bit. So there was a little bit of concern of whether actually the parallel trends were, assumption was met. All right, so here we're getting to results. So I just want to go through a few state characteristics. So these are the states, this is the week that they introduced week of the year that they introduced shelter in place. So California, Illinois, and New Jersey were early adopters in week 12. We get a big second wave in week 13. That's where Minnesota sits. In week 14, another pretty big wave, and then we have some stragglers, Missouri and South Carolina come in, and then there were 5 holdout states that never introduced shelter in place, and that was Arkansas, Iowa, Nebraska, Oklahoma, and Utah. These are the characteristics of the states by whether or not they introduced shelter in place. It's probably easiest just to look here at the total across the SIP states and no SIP states. You can see that the median income of SIP states was higher than those in non-SIP states. The median age is a little bit older. What else? There are less non-Hispanic whites. There are more people of color in the SIP states. And the biggest difference, I think, was the partisanship, so party affiliation. So this is the percent that voted Republican in the 2016 presidential election across the SIP states was on average 47% in SIP states and 56% in no SIP states. And the thing that was really notable to me about the percent voted Republican was look at the gradation here in the timing of SIP, that the earliest adopters were those that were least likely to vote Republican, and those who came in later were most likely to vote Republican. So that was, I think, the biggest correlate. And here are our results. And this is why I'm gonna present results and then tell you why I can't tell you the truth of what's happening with maltreatment. Okay, so this is what we're calling the relative change in outcome. So it's pre-post change in SIP states versus non-SIP states. Sorry, the week is a little bit off here. We're still cleaning all this up. So this is a point, this is the null line here. So this point estimate in week 1 basically says that states, how do I say this? So the ratio of searches for maltreatment in week 1 among states that had SIP in week 1 compared to their average pre-SIP searches divided by the same ratio in non-SIP states was 0.97. So pretty close to the null. Pretty much all these are very close to the null. There's a little bit of a downward tick here. But what is notable is that it's not sort of randomly distributed around the null to my eye. It looks like there's a little bit of a force sort of dragging these down below. There's only 1 point that's above. Could still be random. But you know, there just was the way when we run this a number of different ways, it's just pulling. It just seems like it's living below the null line. So that suggests that in fact there was a reduction in potentially reduction in child maltreatment searches in SIP states as they went through the SIP transition relative to the trajectory of non-SIP states. And here we've just combined the estimates in weeks 1 to 5 and weeks 6 to 10. And just to note that, you know, by the time we get out to 6 to 10, that comparison group is only about, it's just those 5 states that are holding on. All right, so what are some possible explanations for these findings? Well, first, it's possible that we got the right answer, that SIP policies had either no or a very small protective effect on child maltreatment in early weeks. It's also possible that there's a SIP-related increase in child maltreatment that occurred after our study timeframe. So our study ended in August, and at that point, there was still quite a lot of sort of safety net measures that were still in place, like the payroll protection program, the more generous unemployment checks, et cetera. And so what we don't know is what has happened once those safety nets have started to go away and to fray. It's possible that there was a real increase, but due to SIP, kids had less privacy to perform those searches. So these, all we can say is about search terms and actually about search terms relative to total volume. And it's also possible there was another bias or a violation of assumption. And one of those biases and violations of assumptions that we became concerned about was, again, this issue of, there was a sort of combined issue of the search terms being presented as a proportion of total searches and the suppression line. And I want to just draw your attention. These are the black line is the search volume in over time, I think from 2018 through our study, over our study time frame for each state. And just really quickly, you'll notice that small states like Idaho are shifted up, and that I think is the suppression. We're not seeing this, there's like this invisible part of the distribution that's occurring down here. And I want to just draw your attention to Maine. So when we looked at this, we said, my gosh, what is happening? This is the actual search volume we're getting, and you can almost see the suppression line here where there's like missing data, right, in this early, where it sort of like is flat, where there's probably a spike down that we can't see. And throughout this study period, there's sort of a line below which we are not capturing. So this is like my guess at like some kind of suppression line. And then we hit 2020 and all of a sudden it goes down. And so my concern and our concern was that the total number of search volume was such that, it like bends my brain every time I have to talk about it. But if it's an absolute number of searches that below which you can no longer capture, that Google will suppress. That same number of searches will appear smaller in the search volume, right? If the line is 10 here, you can't have any below 10, and all of a sudden, but here that's like, let's say that's 10 out of 100. So here we're able to see the same line along, and then all of a sudden we have higher search volume. Then we're actually detecting the same number of absolute numbers, but it looks like it's going down because that 10 is now out of 1,000. So we're going down. Obviously, that's not the degree that we're seeing it going down. But the point is that the increase in total searches is actually potentially changing that suppression line. So this just was like very unnerving, I guess, when you're trying to run an analysis and you feel like your data are the slippery. So what we did was we said, well, if the suppression line is actually changing, then we should see that in the percent of missing values, because if it's changing, if it's going down, then we should be able to see that there's fewer missing data. And indeed, this is, I think, this is Maine. Maine had a reduction of 25% in missingness between pre-SIP and post-SIP. So we reran the data without those samples, but still it just highlights sort of the challenge of using these data. These are some sensitivity analyses. This is our main. There's a whole process of trying to quote unquote normalize the search terms that I can talk about if people are interested in. I'm not going to go into it, but it's another attempt to address this issue of total search volume. This is what happens when we drop those states that were missing, that had a huge change in missingness. So we do see a bit of a move toward the null. We also dropped sexual abuse in one of the models because we thought maybe sexual abuse was operating a little bit differently. It has a slightly different etiology than the others. Actually, we see that when we just have physical and emotional abuse, we see a larger protective effect of SIP. Okay, some final thoughts. Let me just check my time. So I wanted to start with this question of, are Google Health trends worth it? I think it depends. I learned so much doing this. I mean, these data are publicly available. They're national. They're independent of interaction with mandated reporters. They're not subject to variation in state or local level bureaucracies or budgets. They're available in real time. For questions about things like violence, where we worry so much about ascertainment, I think they may really offer some value. And I think in other situations, they really may perform better. We basically put these data to probably the hardest test that we possibly could have subjected them to. Everything was changing. Total search volume was probably changing. And so we really weren't probably testing them on the fairest, in the fairest playing field. And before anyone asks, well, you may have already asked this, Google will not release the total search volume. So this is not a thing that we were able to do. However, thinking into the future, there's one paper that looked at, I think, maybe trends in abortion, need for abortion or something, and they looked at, they were able to back calculate the total search volume by using the sort of the web traffic of I think Planned Parenthood. Planned Parenthood allowed them to know how many people were visiting their site, and so they kind of used that as an estimation that they could put Planned Parenthood in the search to query Planned Parenthood and then kind of back calculate. So that's maybe a possibility. We are planning additional analyses to look at SIP and intimate partner violence, and we're also interested in looking at some other things like correlations with mobility data and unemployment data. And I'm particularly interested in following this into, this fall and winter when a lot of the safety net measures kind of went away. We won't be able to do that probably as rigorously as we did the SIP analysis, but I think it's still worth looking at. And then finally, why do we have such terrible surveillance data for child maltreatment? This is just an enormous issue. So this is something I have been spending a lot of my time thinking about, like, what do we do to actually get reasonable data so we can understand what's happening to children during big issues, big events like this, and at other times, things like policies. All right, I'm going to stop there, and I'm happy to answer questions.
Really interesting. Thank you. There's several questions in the chat. Would you like me to read those, or do you want to handle them yourself, Susan?
I don't mind reading them.
Okay.
Yeah. Okay. So David asks, I think you've elegantly proven, thank you, David, that design studies are superior epidemiologically to data collected for completely different purposes. Yes, clearly Google Health Trends data would not be our first choice if we were designing a study. That said, I don't know how you would design an epidemiologic study that was vast enough and continuous enough to answer these questions that sort of arise in real time. So I agree, and at the same time, I think we also need to think about how to be creative about using existing data. After your experience working with Google Health, will you continue using the source of alternative sources mentioned? Yeah, so I did answer that a little bit. I think so. I mean, I don't know that it's any worse than what we currently have in the MCANS data. I think it has some problems, but I think the NCANS data is quite seriously limited and also potentially quite seriously biased towards certain populations. And so I think it's better than that. I mean, I have some other thoughts on how, and my colleagues and I are talking about other data sources as well. So I don't want to have to rely on Google data alone. Did you consider using search terms that you did not predict would have changed in volume? So, all right, so this is the question. Did you consider using search terms that you did not predict would have changed in volume so as to get to additional insight into whether it was an issue of total search volume changing? Okay, so this is actually the issue of normalizing. So the idea with normalizing is that if you can think of a search term that you think stays constant in absolute numbers over time, absolute numbers, then so basically imagine two ratios. You've got your searches divided by total search volume, and then you normalize by dividing that by the normalizing term that you think stays constant divided by total search volume. Now, the total search volume cancels out, and what you're left with is your searches divided by the normalizing term searches. And so that, if you can be confident that that normalizing term stays constant, then that will allow you to get will allow you to understand what's happening in absolute numbers with your search volume. The problem is, what is that term? We spent weeks trying to figure this out. And we couldn't figure it out. We actually thought maybe we should go the opposite direction and use coronavirus, like some combination of coronavirus and fever, because at least then we know what's happening. But one thing I just want to emphasize is because anything you do in the Google API, what you get returned is that search term as a proportion of total volume. So one normalizing term that people frequently use is and. So we looked at that. So what do we find? Well, and seems to go up slightly after the coronavirus. But does that mean searches with and are going up? So that means that searches with and are going up relative to total search volume. But we still don't know what's happening with total search volume. And I don't know. I don't know. So anyway, it was just like a puzzle. We kept having to remind ourselves of that. It was so mind-bending. All right. Did you consider, okay. Was having multiple time periods a problem for the difference in difference model, mainly if the effects are not homogeneous? Are you planning on doing an event study to help check parallel trends assumption? Not totally sure I understand this question. Maybe the person who asked it can clarify. I assume that means the effects are not homogeneous. I don't know if you mean the effects are not homogeneous over time or across different states that implemented at different times. So anyway, if you have other thoughts, if you can clarify, that would be great.
Would you like to speak, Renzo? I don't see the hand going up. Oh, here we go.
If someone else knows better.
Here we go. Here's Renzo. You can speak now.
Hi, Susan. Thank you very much for your presentation.
Yeah.
Yeah, so I was just wondering, because when you have multiple time periods and you're doing the diff and diff, you can expect these changes to be homogeneous across the different states in different times. So for week one, after the implementation, you expect all of them to have the same level of effect. So when having multiple time periods, the problem is that you usually have heterogeneous effects. So those who are passing 2 weeks after the implementation of the SPI will be different than having 3 and so on. So I don't know if you have considered that, maybe that's why you wouldn't see in those effects as you would expect. I'm not sure if that's clear enough.
Yeah, we spent a lot of time thinking about I'm not sure if this is getting what you're asking, but we did spend a lot of time thinking about, what is there's like shifting comparators over time. So, you have, especially as you go out, you're losing comparison. I mean, I think, I don't know how to look at whether, did you have a suggestion, Renzo, for how to look at that?
Yeah, so there's Dr. Calway and Dr. Santana. They developed this new model where they can actually account for those differences, especially when you have a multiple time periods. So I can send you that, and I can send you the paper on that also.
Yeah, that'd be great.
It kind of derives also like an event study, but it accounts because, as you said, if you have this state that enters the policy late and you compare them with one that enters the policy early, then you will have some bias and the way the definitive weight is that could be run. So I can send you that.
Yeah, that'd be great. Thank you.
And then Teresa has been waiting in the wings, so she could speak now. It's nice to hear people.
Hi. Yes, it's nice to hear people. Susan, this talk was really wonderful and creative, and I'd love to see your creativity. I had a couple of questions. One question was, I believe you're relying on children to enter these terms, right? Like mom hit me. And I wondered whether you had an idea of what age you would expect a child to be able to do that, or the valid area that children can get in to see searches. So that relies on access to the internet, like you said, about monitoring, parents monitoring, or being able to read and write and type and all that stuff. So that was my first question. And then the second question was about Google. I don't know anything about these Google Trends data. Is Google open to giving you any more information on their, if you contacted their research team? It's kind of a naive question about whether Google would be.
I mean, we were similarly naive, and our grad students were awesome, and they contacted and nagged. But I think the reality is Google doesn't make any money by doing this or talking to researchers. Oh. So I don't think they have any incentive to help us out, unfortunately.
We could get a NIH grant to work with them, but they would probably laugh at the amount.
Yeah, I know. Yeah, right. I mean, the amount of money they make. Yeah. Anyway, and in terms of age, it's a really important point and something that we thought about a lot. I think that third grade is probably the younger end of that spectrum, and so we're missing things to young children. I have some colleagues who are child abuse pediatricians who suggested thinking about search terms that might like be from non-abusing caregivers, or even the abusing caregivers, like things like what could cause a bruise on a child, or things like that. So we started looking at that. We decided not to mix them together because it was a little hard to figure out what that would be capturing versus what we were capturing. We just thought it was cleaner to include these particular topics and just acknowledge that it was for older children. But yeah, we were totally missing younger kids.
Yeah, and I would think also that this would, I don't know, in thinking about incidents versus repeated incidents, like the first time may be different, and a child, would be more likely to search on things if they knew that it was wrong, it was disturbing, so it was extreme, and it was not the first time. I mean, children who are, inculcated into abuse from young ages, like this is not, I imagine you wouldn't capture them, like they're not going to be, their awareness is, I'm not saying it correctly, but they're so, the abuse is so ingrained in them, it's not going to be something that's
Yeah, I think that's totally reasonable. And then, I mean, we also, like, there's a question of like, when do you expect an effect? Do you expect it to occur in the first week? Or is this
That's what
something
this
that
is
accumulates
capturing?
over time?
So
What?
this is capturing only the first week?
No, we go 10 weeks out. But, you know,
Yeah.
who knows? It's hard to know. And it was, I don't know. It's really hard. I think there's like a lot of assumptions and limits here. But I would just emphasize that, like, most of our studies have assumptions and limits, and that, like, particularly when you're studying something like child maltreatment, and people aren't going to just like talk to you about. There's even more sort of an uphill battle, and other options aren't really great either. So I think it's worth digging in, and I've seen some great discussion in the chat actually about some additional ideas for sort of triangulating, which I think is exactly what needs to happen.
And there's a great question here from Ryan Demmer that I think is interesting.
Yeah. Okay, so this is a question about whether your search strategy yields different results by region. We actually talked a lot about this, like how to, about regional kind of vocabulary around certain things. Again, our grad students did a lot of looking at these things and trying to understand how they might, and including terms that would be relevant to multiple regions. I think that honestly, we were most concerned actually about sexual abuse because of the kind of euphemisms that people use around sexualized body parts and sex itself, and the way that's so regional. For things like physical and emotional abuse, I think the term HIT has kind of a constant meaning, things like that. So I didn't end up becoming enormously concerned about it. But part of that was because our grad students did so much legwork. Diane asked a question about total search volume. I wouldn't expect an increase in searches on abuse if not happening. So I just want to be clear that the total search volume is every search that Google, every search in Google. So if I have 10 searches for abuse, it's presented to me, and there's 100 total searches, then it's presented to me as 10 out of 100, or 10%. If that 10 stays constant, but the total number of searches for everything goes up to 1,000, then that goes down to 1%. And I don't know whether it's the actual searches that are changing or the total searches for everything else that are changing.
And then Rachel would like to ask a question.
Hi, Susan. Thank you for such an excellent and super interesting presentation. I'm so impressed with how much work your team did and how you dealt with all of these challenges that you encountered. One question I had was sort of about thinking about structuring research in an area where the outcome and the topic is just so difficult and upsetting and potentially triggering. And I know all of our outcomes here in epidemiology, or a lot of them are pretty bad things, but I was wondering if you could talk a little bit about, sort of how you structured and sort of set up a situation where grad students could be potentially, collecting information on this, doing searches for some things that are probably pretty rough. I'm guessing sometimes returning some things that are not fun to think about or look at, and kind of how you set up a situation where people can be okay.
Yeah, that's a really good question, and I'd have to say, because I work in this area, I can be a little bit like I can be a little bit maybe less, I don't know, attuned to that, or not as much as I should be. I mean, I think this wasn't by design, but just happened to be the case that we just ended up with a really great collaborative team. Like, there were 6 of us. We got along really well, and we met every week, and we just allowed. I think we. I don't know that I didn't. Thinking back, I probably should have done more to make sure everyone was okay, but we definitely gave a lot of space. Like, every single stage of this. probably took longer than it should have in some ways. But I think because there was space for discussion and debriefing, we were able to hear any concerns that the graduate students had. And then the other thing that I think was probably really valuable, and I would have to ask them their opinion, is that that they, because there were 3 grad students and they all got along, they were able to be kind of a source of support to each other. And what I hope, and I don't know that this is the case, is that, you know, if someone felt really fatigued or burdened or upset by any of the tasks, that they could reach out to others to step in. We didn't see, I mean, from what I know, our students were not highly upset. I know that the student who was reviewing qualitative research said that she found that very, very hard to read and troubling. And so that, I think, was the hardest part. But other than that, they've been very, they've taken it in stride. And I certainly hope that they would feel open, you know, okay with letting me know if they did find it too upsetting.
Great. We're out of time, unfortunately. Thank you again. That was fascinating. It led to a lot of great discussion that will, I'm sure, continue. Look forward to seeing what else comes out of this. Hope everybody can join us next week, March 5th. Kevin Riley from Biostats will be talking about the COVID-19 therapeutic trials. So have a good weekend.